Hi, Levi.
Hello there. I'm live. Is it just you and I, or are people in right now?
Yeah, just us for now. Probably give them a few minutes.
Okay, cool. Hi, folks who have joined. We're at 10 or at 4:30, but we're just going to keep people a couple minutes to trickle in. I'm just going to give it one more minute. We've got a pretty intimate little group here, which is great, but we'll see if we can get a couple more folks to join before we get started. And this is going to be a pretty quick meeting today, probably 20 minutes or so, just to kind of give an overview of where we're at with COVID in the state, but we're not going to do any kind of deep dives this week. All right, perfect. We can go ahead and get started as folks keep coming in. So thanks everybody for joining today's HiPAM meeting. My name's Levi Dansinger. I'm a data scientist working with HiPAM, focusing on the COVID modeling piece. So I'm going to walk you through a deck here in just a moment. I'm going to share my screen. All right. And we'll go through our weekly COVID summary. So first, we always start out with Japan. We're seeing a steady increase in cases, still around 1,000, just over. You know, I don't anticipate this to be going up, especially with the rollout of vaccines. So we will keep watch of this, but I'm anticipating to stay relatively steady, at least for the foreseeable future. Again, we'll keep reporting on this every week, but that's how it seems right now. And when we're looking at the mainland, it's looking, I would say, better than expected. There are many parts of the world that are spiking, and there are certain states and areas that are starting to see a rise. But I'm actually pretty surprised given the level of flexibility the governments have now allowed, and how many states are completely open. So this might change in the coming weeks as people continue to get vaccinated and people feel more comfortable to go out, and some restrictions are lifted. So we will continue to watch this, but as of right now, things are remaining about flat. And this remains true for all the states on our watch list here, where we have a lot of visitors and residents living. So Arizona and California both are actually going down. Arizona at 61% down, and California 34% down, which is great. And seeing very similar things across Nevada, and I think most surprisingly Texas, because they're the ones that were first decided to open fully. So again, this could change, but as of right now, we're seeing relatively a positive trend, or I guess in that respect, negative trends on the mainland. So on Hawaii, it's really Maui that's driving a lot of the case counts right now, and a lot of the issues. So this is obviously a big problem, just given Maui's limited capacity. So this is going to be something that we're going to keep watching. In terms of the probability of the cases rising dramatically, probably not as likely, just given Maui's population and given that most of the cases are not on Oahu. It still could change at any moment, but hopefully going to be staying relatively steady from a total case count perspective. But we're going to keep a close watch on Maui as this continues. Also from a vaccine standpoint, so we've had over 700,000 received and almost 800,000 ordered. And of those, 80% have been administered, and we're at about 24% of the population that has received at least one dose. And this has been pretty consistent with the national average. I think some states like Alaska are the highest with about 32, some are a little bit lower, around 21%. But for the most part, we're kind of right in the ballpark of everybody else. So this has been on a relatively good trend, and now we're in phase 1C as well. So some of the other essential workers are getting vaccinated, as well as people with high risk. So hopefully we're going to see even more vaccines rolling out to different populations soon. And again, the testing turnaround time, I don't anticipate this to be changing much. We're still keeping track of it, but still most tests at this point are turning around in a day. I think the system really is pretty streamlined at this point, which is great that we have that kind of consistency right now. So when we're looking at the forecast, I would say that this is actually pretty aggressive right now. This is almost more based off of the trend that was happening a few days ago. So we have been seeing a slight downtick, and this is us just being a little bit overly pessimistic, I would say. As you can see, a lot of the forecasts from the CDC, those little gray lines for the cases and the deaths, but particularly the cases are relatively flat or maybe going up just a little bit. So I think that within the next couple days, if we continue to see flat or slightly declining numbers, we'll probably revise this forecast to keeping the RT at around 1 or maybe even slightly below. So these numbers, again, reflect probably an overly pessimistic view of what's going to be happening unless we see a pretty dramatic swing in the other direction. So, with the cases, we are saying that it could get, as bad as about 30% up from now. Again, I think the percentages don't matter quite as much, just given how low the current numbers are at this moment. And the deaths you're going to see are likely going to be remaining low or negative, even if we do see rising case counts, mostly because we've adjusted the death rate to be lower, just given the fact that we've had a lot of our kahuna vaccinated at this point. So it's likely that even if we are seeing more cases of COVID, the deaths won't be as great. That doesn't necessarily mean that that's always going to happen if there is some kind of infection in a nursing home or something like that. But just statistically, we're kind of assuming that the overall deaths are going to be going down at this point. So we just have two science highlights that we want to touch on this week that are important. One is the update from the CDC about K through 12 schooling, and another is the efficacy of the vaccines for Pfizer and Moderna. So the CDC just released this on March 19th, talking about how to reopen for K through 12 schools and encouraging it. The physical distance has been dropped from 6 to 3 feet as the recommendation. Also recommending and emphasizing ventilation as a big component of maintaining healthy facilities. For Hawaii, we're pretty unique in having the ventilation mostly year round, so this isn't as much of an issue for us. So it's good that a lot of our schools are going to already have this aspect inherent. The CDC is also recommending to remove physical barriers like those plastic walls in between desks as well. And also clarifying a little bit more the role of community transmission levels in decision making. So it's very similar to the Oahu tier strategy that Mayor Caldwell had rolled out with the different colorations for different case counts. So they have that clearly listed on the site. And lastly, again, with that added guidance on interventions when clusters occur. So it's a lot more thoroughly laid out than how it was rolled out previously without a lot of guidance. So this has a lot more detail, and I think is a much more effective rollout. So outside of schools, when we're looking at the vaccines, there's been a couple studies. This is one from Texas. There's also a New England Journal of Medicine article on California as well with very similar results, but we're going to be looking at Texas here. So this study looked at about 23,000 healthcare workers, and specifically focusing on healthcare workers because they're going to be the most likely at high risk to be exposed to COVID and contract it. So this is really kind of showcasing the vaccine's efficacy on the front lines. So this is a group of people that are either partially vaccinated, fully vaccinated, or unvaccinated. So it's a pretty even split between the three different groups. And this study ran for about 2 months. And the amount of people that contracted COVID was only 350 of the 23,000. And most of them were in the group that was unvaccinated, which is a little less than 3%, partially vaccinated, a little less than 2%, and those fully vaccinated, only 4 of the 8,000 had contracted COVID. And I think with that, these are the people that are also symptomatic. I'll have to double check on that, but I'm pretty sure that's how it's defined here. So really good efficacy rates, around over 90, 95% in a lot of these cases. And I think the California ones were very similar, at least 95% in that as well. Of course, we are seeing some people with vaccines. I think little anecdotes pop up across other states, but hopefully, again, these numbers are going to remain relatively low and the overall efficacy stays high. So that's what we have from the science highlights. I'm going to go into chat and answer a question from Tammy. So do you know why they removed the recommendation for barriers for schools? I don't know why they did that. It could have been a cost issue, but I'll have to double check. I can send that out later, but I'm not entirely sure what the recommendation was. other than just assuming that it probably was a cost to efficacy way that they engaged in. Does anyone else have any questions? This was a pretty short and sweet. Oh, thank you, Dr. Wu. So physical barrier removal may have been due to some folks setting up barriers and impede ventilation. Yep. Any other questions from the group? Okay, great. So we're going to give you lots of time back today. I think we're going to be moving to an um, oscillating schedule on the deep dives that we're going to be doing. So I don't know if we're going to be doing those every week. As I'm sure we'll discuss that next week. But thank you guys so much for joining today, and we'll see you all next week. Thanks.